Okay, we are back. We are back.
Okay, so we're going to take a look at a couple more muscles.
Okay, so we're on to the next muscle. So we did the rectus femoris. We're going to look at the vastus medialis and lateralis. Those are the other two quadriceps.
So let's take a look at the medialis.
Sharon, I'm a little confined by the cord.
Oh,
here.
sorry.
So
Let me come on over there. Yeah.
Okay, great.
Okay, so the vastus medialis, which is right here, so you can see it attaches right there at the lesser trochanter and comes over here, and of course ends up here at the tibia as well.
Great.
And that causes pretty bad knee pain on the inside anterior part of the knee.
Great.
And it's also the nerve root L4, and it's what you call the buckling knee syndrome one. So sometimes when the knee just buckles underneath you.
This happens to football players. They'll just make a sudden cut to the left or right, and all of a sudden the knee will buckle.
Just buckle. Also, it could be holding the patella as well as the...
You won't be able to move it to the side. Yeah.
You won't be able to move it this way too good. And the vastus lateralis, we'll be looking at that next, and then that's also important in the patella moving as well. So here, we do this one next. This one, so we'll treat that when they're laying sideways.
And the good thing is the pain patterns follow their position. The medial one causes medial knee, and the lateral one causes lateral.
That's right, it does. That's right, yeah.
Well, how do you evaluate the range of motion test with these guys then?
Well, we already did one of the range of motion tests, but we could do a couple of different ones. One of them is the range of motion of the patella.
Oh yeah, the patella, that's right.
So we want to see, relax a little bit, relax, okay. So does the patella come down? Does the patella go inside? Does the patella go outside? Does it move? And does it come down? Which is it's coming down, but not enough, okay? And it's going lateral a little bit, and medial and lateral a little bit. So it's going to the outside and going to the inside, but it's not coming down enough.
Not coming down enough. Okay.
Not enough. Let's take a look at the other one. So
the book she's using is the Travell and Simons book.
Yes.
The famous red book, 2-volume
yes.
encyclopedia to myofascial pain.
So here's the volume 2, myofascial trigger point therapy. So it's myofascial pain and dysfunction, the trigger point manual.
Yep, lower extremities, part 2. Yeah, great.
You can get those at a good price.
Yeah, they're pretty cheap on Amazon.
Okay, so let's take a look at this knee. So does it's not relaxed a little? Okay, so we want to it will go lateral, which is going a little bit, go medial, it's doing that some, but it's not coming down enough.
Okay.
So we'd like it to come down more. So we're going to take a look at that.
So that's one range of motion test for the vastus group.
Another range of motion is you can do where they're laying on the table, and you could do heel to the buttocks test. Supine.
Now you see the hip is flexed, so that takes the rectus femoris out of the picture.
That's right. So you can measure from the ischial tuberosity to the heel, and that's like 6 inches.
6 inches. Okay.
And then let's check the other one. Let's check that side. And so you can go ahead and you go from the ischial tuberosity to the heel.
Yeah.
And then this one here is more like.
Oh, that's really tight on this, so you can see that.
Yeah. Okay.
Okay.
So, all right, so let's see.
You're walking around with that? Celebrities.
So we're going to take a look at the medialis. So for this, we're going to come about here to the lesser trochanter right here and go just like this to the inside of the knee. Just like that, right there. Yep. So I'm going to take a look at that right here.
Is there a famous trigger point, or pretty much this is all along it, right?
Yeah, well, when you get closer to the knee, that's the one that causes the knee pain.
Ah, okay.
This one causes it more, a little higher up.
Would you change anything if there was a knee replacement or anything? Or you'd pretty much treat it the same way?
With knee replacement, you can do a terrific job on getting increased range of motion, full function.
Great.
So I would say, I do think about the fact that they had a knee replacement and consider that as part of the treatment.
Yeah.
And so I will think about that. But people with my first job I ever had in 1985, I meant, was working for 3 orthopedic surgeons, and I treated pre and post surgery. Okay. And so I got the good feeling for how the trigger points would fix a lot of times before the surgery, and then I'd also have to fix them again after the surgery.
Yeah. How's that feel, Kirk? Pretty
last
brutal?
one was a bit rough.
Pretty brutal. I heard some groaning.
Yeah.
These ones aren't quite as bad.
Yeah, it's good to breathe.
So we're right on the medial side here, the inside. We're coming towards it. Remember, so the trigger points about right here would cause you to have the medial knee pain. But we want to make sure these muscles get longer because we want the kneecap to relax. Go ahead, relax a little bit. Relax a little bit.
Thought it was.
Okay, there it goes. Well, I could tell because the kneecap went down before and then it stopped going down. So I checked that out a bit earlier. So you did it a couple times. Okay, so here it's going side to side, so that's good. And let's go up and down. It's coming. It's moving a little more. Yeah. Yeah. Now that's moving more.
Good. Good.
That's good. It's coming along. Okay. So let's take a look at the medial on this side, but let's do this one a little bit while we're stretching, like we did on the other, like we did with the last patient.
That's good. That's good,
Okay.
Kirk. We probably won't have to shoot you after all.
I don't know.
Okay, let's scoot all the way down. Keep coming. You have to sit way on the edge.
We're going to give this a real good stretch, huh?
Good.
Okay.
Whoa.
So I think you just got an awkward position.
Okay, sure. Okay, let's have you come all the way to the edge of the chair. Okay, and then put your feet on there. Okay. Okay, good. Okay. Okay, and then let's see. We'll take you back. Let's have you go ahead and lay back. Okay, what do you think?
That's fine.
Okay, good. Okay, so let's bend your knees a little bit more. Great. Okay, so we're going to take a look at the fasciitis case again. So here's our femur. Okay, so it comes about right here to where the lesser trochanter would be, and then we're going to treat the whole muscle all the way down to the tibia. Okay, so we're going to go ahead and take a look at it here. So here now I can feel some taut bands right there.
Yeah.
Yeah,
Right.
because we put it on the
He
stretch.
agrees.
So since we put it on the stretch, you can feel the taut bands better. So that's one of the advantages.
Yeah, yeah. It's not that we enjoy causing pain, but you see, we have to figure out the position where the nerve in that tissue is complaining the most. And we need to make sure it's not complaining in shortened position, in neutral position, and in lengthened position. It has to not complain in any position to be full function. So,
And for him, he'd like to be able to kneel
yeah, exactly.
and to work.
Yeah, and that's the other measurement is daily
Function.
activities, function, yeah.
Can we have function?
That's right.
Now here, this is now it's getting closer to where it would bother your knee.
If you're like me and all you want to do is stay in bed 24/7, well then you don't need, full function for me is, basically need to breathe and be able to reach for food and drink.
In order
Tilt
to
my
go
chin
around.
up, tilt my chin up to watch TV. No, I like a little more function than that. You really realize how much function you need when you become a parent, and then you've got kids that are requiring lots of function.
How old is that little guy?
Oh, he's 19 months,
19 months.
but he is so easy. He's really easy. But yeah,
So here I like to put my elbow into my hip. Then I have my hip pushing.
yeah, you're using your body weight through your hip, through your elbow, through your hands and knuckles, right onto the joint. That's it. It's good.
And it's good to, when you're doing this, is to use everything as straight as possible.
Yes,
And so you're going right through all your bones.
exactly.
Mm-hmm.
The truth of the matter is that not only is it, ergonomically it's better for your joints, but you actually have more control. When you have a longer lever arm like that, your control is better. If you were just pushing with your wrist only, you would have
Then you go
less,
like this.
Yeah, you'd have less control
Yeah,
to be able to,
and you collapse.
yeah, you'd have less control over the minute angles and things that you need. Because Sharon might sometimes add a twist when she's in a certain area. She might feel that the fascial plane.
Yeah, maybe I'd like to, frequently when I'm treating, I don't go just in, I often am going a little bit this way and then
Yeah.
a little bit that way.
Yeah, yeah.
And then here, you know, I'm gonna grab it and pull it.
Yeah.
So I'm usually pulling.
So this
I'm
way
doing the
she's using her
compression.
body weight for the long axis compression, and then she can use her wrist to do some twisting or angle, you know. And wait, so that's really another great trick of the body worker, the master body worker, is that they use long lever arms and body weight to their advantage.
And sometimes it's nice to use this elbow.
Yeah.
And sometimes it's nice to use the other elbow.
Yeah, exactly.
How many of you have a favorite elbow?
Favorite elbow.
Now, one time I was holding
Your
my...
elbow's my favorite elbow.
So one time I was holding my daughter in one arm, and I was carrying a cat in the other arm, and I slipped on some black ice.
And you had to decide which one to save.
Yes, I did. I did. Oh God, you're right. You're right. I had to do that.
Her daughter is still alive.
That's right.
We don't
So-
talk about the cat anymore.
No, we don't talk about it. So I had to save my daughter. So it was my right elbow, and I had to save my daughter. So my elbow, I broke it.
Oh.
So what do you think about a trigger point therapist with a broken elbow?
Oh.
I had to hire somebody to be my right arm.
Oh, wow.
And I did. I hired someone, and they were my right arm.
That's not a painless fracture. That's a very painful fracture.
But
Tip of the elbow.
remember they told me I'd never be able to bend my arm.
Yeah, you can see it's still dysfunctional.
Yeah, they said I would
You can't
never
really
be
do
able
anything
to.
with that elbow now.
Yeah. Right, I can't do anything with that elbow.
Apparently not.
No. Okay.
Maybe she
So
get it replaced.
I was going to have you lay sideways.
Okay,
So
which
what would
side?
be the best way for you to go sideways?
We had a question about treating the patella.
Okay.
Sharon would work. She'll show you. She work all around the sides.
So usually I like to put the body support. So why don't you sit up for a second? I'll put the body support underneath you. So I'd like to have you lay sideways. So I'm going to put the body support system underneath you.
So to get more of the vastus lateralis.
Yes?
Yeah, this is
Okay,
a
so
great
Scalata.
position. All of you
Okay,
should
great.
be doing this. You should have tried this by now because this is a phenomenal position. Patients love it. It's so comfortable. You get a little cervical roll there, and they don't even want to get off the table. It's so nice.
Okay, so in this position, now you can actually see how much improvement you're getting while you're doing it. So here, yeah, I can often I'll put a little bit of I'm putting just a little bit of a pressure on it.
Yep.
And then at the same time, I could treat it. So I'm going to put a little pillow under his knee.
Yeah, between the knee, it's good to have a pillow there.
Oh, that's where I found that.
You got
Maybe
this one on the
give me a
side.
big pillow on that side. There's a bigger one. But that's a good start, though.
Do you want to use this guy?
No, this is good enough. Okay, so here's our vastus lateralis, and here's our greater trochanter, and then it's going to come down, attach here. So let's go ahead. Let's take a look at a picture of it, because it has nice pain patterns. So take a look at here. So here's our.
Huge all the way.
So it causes pain all the way up to the hip and all the way down, kind of like a curve underneath the kneecap.
Like a putter.
Like right underneath there. And then you can see here it's attaching here a little bit onto the tibia, and there's a little bit of a little ligament, the lateral collateral ligament we'll look at there. And then you can see it causes pain in different all over on the outside of the knee. Okay, so we'll give it a nice treatment. Okay, so find the greater trochanter. Then we're going to come into it. So what do you, oh, that hurts there, right?
Yeah.
Oh, okay. Not that bad, though.
Means you're doing some less working.
Yep.
Okay, so here. So we're going to give it a little bit of a stretch while we're pressing on it. So our vastus, lateralis. How are we doing on time, Justin?
Good. We've got 5 minutes to 9, and I think people are probably getting a little, after a long work day. We should probably be pretty quick to the rest, I would think.
Okay, we could do that.
Yeah.
Okay, good.
I'm sure some people have been working since 8 this morning.
I started started working at 6:30.
Some of us have to get to work at 8, not tomorrow morning.
So I started, I think, 10 o'clock tomorrow.
Oh, you get to sleep late.
9:30.
Well, okay, I start at 9:30 tomorrow.
There you got one.
Good. Okay, so a lot of times you know you got a really good one is when you press on it, and all of a sudden the knee bends more. And part of the vastus is kind of in the back here, so maybe it was, that kind of acts a little bit like a hamstring. So I'm going to go ahead and treat that a little bit, stretch this way.
Yeah, the very back part of the vastus lateralis. Yeah, it's good to actually. It's different than the rest of the muscle. It does act a bit like a hamstring, so it's important to know.
Well, and even when you're doing we could do the standing toe touch also for that test. That also could give you the vastus lateralis.
Oh, wow.
Do you want to hold this? Sure. Okay.
Okay, let's see how we're going to do. All right, let's give it a little stretch. Go ahead and push your foot towards me and relax. And push it towards me and relax. And push it. Come see how close it's going. So now it's one finger. Okay, 1.5 fingers. See? There you go. Push towards me and relax. So it's getting real close. That's really close. So you did really good. Super great. Now we just have to see if you can kneel. Okay, let's turn you over on the other side. Get your shoulder in that little crevice under your neck there. Let's go ahead and put this under your knee. Okay, so again, we're going to go ahead and treat it. So here in this position, so you see we got about 5-6 inches here. Let's see, I got my measuring tape right here. So we're starting out, and we're gonna, so I get a little bit of pressure here. I'm gonna go ahead from the seat to the heels at 6 inches. Okay, so we're gonna go ahead and treat that while we're, so here we're gonna find the greater trochanter, can come just a little bit below it. We're gonna go ahead and press right there. What do you think of that?
Yeah.
You can feel that?
He feels it.
How painful is that?
Pretty good.
Okay, good.
I can really do something.
He's
Something?
talking, he's not gasping, so it
It's
mustn't be
it's not
too
too
bad.
I'm used to this.
Okay, oh, so I get touched there, and all of a sudden, now it's closer. It's a little bit like 5 fingers.
That was a free.
So we're coming down towards the knee,
Maybe
and
more.
so I'm just giving it really light pressure, like almost like just, but I'm noticing if I press a spot, does it come closer?
They're asking lateralis?
Vast. Oh yes,
Yes.
I'm vasting lateralis.
Okay.
And let's do a little bit while we're stretching it this way. So here's our greater. So come just inferior, and we're going to put a little bit on the stretch here, and a little bit on the little right here. And as it seems like it takes, you could take up the slack as it seems to get a little stretched a little bit more. Okay, that's that. So here I'm just looking at this little collateral of the lateral ligament here. So I was just going to take a look at that. And you noticed it?
Yeah.
So it comes over here to the fibula. So right there, the fibular collateral ligament. There, right there. Okay, let's see how we did. So we didn't treat it too long, but let's just go ahead and see. Go ahead and press your foot towards me. Push and relax. And push and relax. And push and relax. And push. Good. So we have 3 fingers. Good. Okay, so we improved a little bit. So I like to see at least 1/3 improvement, or 50%, or 100%. And so we improved. That was good. So let's go ahead and have you lay on your back for a minute. And I guess I want to take the body support out underneath. That's fine. Okay, go ahead and lay on your back. Okay, so with your little bit with your legs. So scoot up.
Try it this way.
Yeah, yeah, good. Thank you. Okay, let's see how we did with our knee. So let's see how we're doing. So let's see if our kneecap comes down, up, down. That's nice. That's a little better.
Oh, yes.
That's what you call better.
Feels more.
Yeah, so it kind of moves. Yeah. Let's go inside and out. It's moving. So that would kind of help us to be able, if it can rotate under, then it's going to feel better when you're kneeling on it. Yeah?
Yeah.
Yeah. Let's see this one. So here we come down. This one's a little tighter. This one needs a little bit more attention. Okay, so you could treat your right down the center, down the lateral and the medial. And that will help you with this one. Relax a little bit on this one. Let's go down, side, side. So it seems like this one we want to get a little bit better.
Okay.
Okay, so let's do a little bit of strength test.
Okay.
Also, we can do. So let's go ahead. Let's go ahead and hold it up there, and let's go ahead. And I'm going to push. Have you push up towards me? Push, push, and then I'm going to add some force. Strong. That's what you call strong. Okay. Okay, great.
Functional.
Should we test the strength?
Oh yeah, you can do it if you like. I did one. You
Oh,
did
you
the other.
ready?
Well, you do it. You do this one.
Okay,
That's good.
so for the
I did this one.
for the quadriceps, for the rectus, I'm not for the rectus. We did both joints. For the vastus, we I'm sorry, other side, this side.
Yep.
Like that. Okay. So you have one hand on top of the knee. This hand supports this joint, and so for both of them together, you push straight up into my hand, Kurt. Push straight up, and I add 1, 2, 3. That's plenty good, strong. And to get more of the lateral, vastus lateralis, you turn inward. Remember creating that straight line, and then you push down and in, push up and out to my hand, and 1, 2, 3, good. And then to push down and out like that, bring the knee up. And I'm gonna push down. You ready? Push up in my hand. Okay, and I 1, 2, 3. Okay, good. So they had good strength. Okay. Oh, during testing, you want to tell the patient not to grit their teeth or hold their breath. They will do that. So just breathe normally while I'm doing your strength test, and don't clench your teeth. Okay. Good, good, good. All right.
I think you wanted to do this one. This leg.
Oh, no, it's good enough. I
That's
should.
good enough?
Yeah,
Okay.
that's good. All right.
We did it. We did
Yeah,
it.
yeah.
Okay. So
All right.
let's roll. If you could go roll to one side and then
Yeah.
go ahead and sit up.
We still got a number of muscles to get through, so let's get through 'em.
Sure.
Okay. Okay. And then go ahead and stand up. Okay. So go ahead and sit down and relax for a minute. Okay. So another area we're going to do is the hamstrings and we're going to do the gastrocnemius and the soleus and the back of the knee muscles, the lock and unlock one. So we're going to do the lock and unlock, and we're also going to do the squat test. So if you could go ahead, come over here, and if you could go ahead and go towards touching your toes.
This is a good test for the hamstrings.
So let's go ahead. We're going to test. And so here we're going to test from the middle finger to
You
the
want my
floor.
knees locked, right?
Yeah, for this one, yeah. Over there. Oh, okay. Okay, so that's 6.5 inches. So that's good. Okay, let's have you come up slowly. Great. Okay, so let's feel you lock and unlock your knees. So let's see if you can lock them. Let me feel it. Okay, lock. Good. And then let me see this one. Yep, she can lock them. That's good. You can do it. Okay, so step forward. And we're going to have you do...
That's for which muscle? The popliteus?
Yes, the popliteus.
Okay.
Yes.
Lock and unlock is for the popliteus. Good.
Mm-hmm. Okay, so next we're going to have you come down and you're going to do a deep knee bend just as far as you can go. And so we're going to measure from your ischial tuberosity to the floor. Okay, there you go.
If you hold something,
No.
go wrong. Okay.
No, I don't want you to.
Oh, you don't want me to hold
No.
anything?
Okay, so you're going to go just like that. Okay, and so that's like 19 inches. So
And what muscle do you think that is? Soleus.
that's right.
Yes.
They know.
Last time I was 17 inches, so I'm tighter. But that was
No, 16 is better.
no. It's better if it's
Yeah.
Yes, but last time we did that, I was 17 inches.
That's worse.
Yes.
Okay.
But that was a long time ago.
Oh, a long time ago. Okay, good.
Pre-accident.
Oh, okay,
Yes.
okay. 1 inch difference. Okay.
Yes.
All right. So let's take a
All
look at treating the hamstrings,
Mm-hmm.
and let's take a look at the popliteus and also the soleus and gastrocnemius.
Okay.
And we're gonna do another test when you're laying down.
Okay.
Okay. All right. So let's have you go ahead and lay down on your tummy.
So we're kind of working the back muscles, the back of the leg muscles and thigh. So we
Put
did
them
the
together.
standing toe touch for the hamstrings.
So we did. So we're gonna do for the soleus the bent knee.
The knee bending because the soleus, remember, just like the rectus crosses the hip joint, but the
Soleus.
vastus does not.
Mm-hmm.
The gastrocs cross the knee joint, but the soleus does not.
That's correct.
So
So here we're looking, do we have at least 15 degrees of dorsiflexion? So here is straight, so go ahead. And that's pretty good, but let's see if we can get it a little bit better. So we could give it a little test also. So we could look at how many degrees. So we could go put this right here, put this along where the foot is. So let's go ahead and give it, all right, and let's go ahead and measure that. So that's about 10 degrees. So let's see if we can get it to 15 or 20,
Okay,
something
great.
like that. Okay. And then the other would be the gastrocnemius test. So this would be, and here we're doing a little better with that. You can see we're getting about 20, more than 15 degrees there. So the soleus is a little worse than gastrocnemius.
yes.
And let's show you yeah, this is good. So this is the straight leg dorsiflexion.
That stretches two joints, so
Mhm.
that's how you get the gastroc.
Okay, let's look at the popliteus.
And the popliteus muscle,
Yeah, so here is, so this would be the stretch, and that would be the contraction. So it's let me get my finger right on it. So that's the stretch, the contraction. So it doesn't want to do the contraction. I can feel, she notices that. So I feel it stretches, but it doesn't want to contract. Yeah.
all right.
So let's check that popliteus right here. And let's show you a picture of it. Okay, this one doesn't want to contract at all, and so it just gives us a slight stretch, but no contraction.
Okay.
Okay,
And
so
heel the buttocks for the, shortening for the hamstrings, but we already did that for
well,
the
we
quads.
can look at here. Yeah,
Yeah,
so here's
that's
our heel to buttocks.
Do you want to see how I
6
would do
fingers.
the strength
Oh
test
yeah,
for
let's do
these?
the strength for test for those.
Okay.
Yeah, let's do that.
So you could just stay in that position.
Okay, great.
Okay, so for the hamstrings, bring the knee not up to 90. There's the muscle fibers overlap too much at that point, and they're locked, and you wouldn't really have a good strong test. So you bring it up just to 30, okay? Hold that right there. And what I do is I would use a straight arm because this is not a very strong area for the tricep in this position. So say push up into my hand, and then I add push up into my hand. You're pushing down. You see how you're pushing down? I haven't pushed down yet. Just push straight up. Now I'm going to add 1, 2, and there's nothing there. So hamstrings are definitely showing a lot of problem. Okay, so push up into my hand, push up, and 1, 2, there's nothing there. So neither of those. So both those showing problems, okay? Those are the hamstrings. You could differentiate between medial and lateral by turning out, and that would give us more of the medial hamstring, or turning in. Ooh, it doesn't turn in. And that would give you more of the lateral hamstring, okay? What was the other one? Oh, popliteus. Okay, so knee 90 degrees, you have them turn in like this, keep that in, and I'm going to twist out. So you can see how much foot is bending. The foot doesn't even stay straight, so you know the popliteus isn't doing anything. She's using her all sorts of foot muscles to try and substitute. So twist in, it can't even hold in. So, and I just twist out. So twist in, and I twist out. Oh, just gone, right? Push, 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 okay. No popliteus muscle at all. That muscle's same thing Sharon found. So same thing here. So turn in. Ooh, it doesn't really want to turn in. And I'm going to twist out. You don't let me twist out. See, it just comes apart. Twist, twist, twist. No. Okay. All right.
Got it.
The gastroc, different than the hamstring, what you have to do is you have to, point the toes. That's how you point the toes and relax a little bit. Relax, honey, for just a second. Yeah, down to 30. Now point the toes all the way. Now push up into my hand. Now I add 1, 2, 3. Okay, amazing, right? If you have the foot flat like this with his hamstring, push, push, nothing, okay? But when she tenses this, that foot flexion, that puts the gastroc in the mix. Push 1, 2, 3. Okay, so gastroc's good. Gastroc's
weak
good.
With hamstring.
Hamstring's a mess.
Weak with popliteus.
Just one more time on this side. Point the toe to engage the gastroc. Push up into my hand. And I add 1, 2, 3. Okay, good. So,
Super.
popliteus,
Really need help with that.
really need help. Hamstrings really need help. The gastrocs are pretty good. Soleus is a little bit trickier to test. You point the toes, and then I actually push down and out. But that's plenty strong, and I don't think it's a great test, in my opinion. Push up, and then push up. Yeah. I don't do that test very often, but that's how you test it. It'd be hard to find a weak one, pretty much. But all right, good.
Okay. So, how's your comfort level? Should we put the body support system underneath you?
Yes.
Okay. So, why don't you come up on your hands and knees, and we'll do that.
So we're gonna hit those 3. We're gonna hit 4 muscles. I'm sorry, the strength tests are not on the poster. That is applied kinesiology, and you could look it up. You might be able to find some things online.
Well, you wouldn't want to have any more on that poster.
No, not anymore on that poster. The poster is just for range of motion tests. The strength tests are not on any poster that I know of. There's a book by Walther, W-A-L-T-H-E-R, that tells you every single thing you could possibly need to know about applied kinesiology. Really amazing book. You could spend your whole life studying it. But they have the strength tests and everything that you could need to know. I mean, acupuncture, holographic, amazing stuff, isn't there? But we're showing you all the strength tests in this course because you might like to do them.
Oh, it's so important because you have to have the length and you need to have the strength.
Yeah.
So as soon as you have the length, then you want to go for the strength.
Basic premise of every strength test is line up the muscle so it's as straight as can be. The fibers are in a straight line. Then push 90 degrees against that straight line. Have them push into you first to engage the muscle, and then you add 3 to 5 increments of strength.
So one of the things that causes significant knee pain is the lateral, the biceps femoris, the lateral hamstring.
Yeah.
This one causes some medial, but more buttocks.
Yeah.
So
this one goes up, medial side goes up, and lateral side goes down.
So the more important one for pain in the knee would be the one on the outside.
Exactly. And I find that they get a lot of problems at the Golgi tendon organ where they insert right below the knee onto the tibia. Lots and lots of little nerve bundles in there sending signals to shut this off. Remember, where would the Golgi tendon organ be on the other end would be right at the sit bone, right, the ischial tuberosity right there. And then they'd be right there beneath the knee on the tibia is where the other Golgi tendon
So
organ
this is
be.
where you want to start. So here's our ischial tuberosity.
Yep.
So let's feel it, and we come just right below it, and you're going to go right onto where the muscle attaches.
Yep.
And let's go a little bit lateral to get the lateral attachment right there. right on it. I feel we're right on it there.
Yeah, yeah.
And we're going to come down inferior. And then I like to give it a little stretch. So I come over like this and stretch the lateral a little bit
Wow.
while we're treating it.
How's that feel?
That's, I
Wowsy?
noticed it quite a bit.
You're noticing it quite a bit. Great terminology.
Oh, yes.
So if I have the table down lower, I might use my extended arm
Yeah,
rather than my elbow.
yeah.
So coming in, looking at the lateral.
And we mentioned that correlation finding that George Goodhart had with vitamin E and problems with a lot of the muscles in the thigh and back of the leg. It's kind of interesting. Hard to prove clinically, but they did show really interesting matchups between those clinical findings and the blood work. So, you know, if you got someone who just can't get better, maybe they don't have enough vitamin E, and who could use a little
Another thing
vitamin
you could
E?
do is you could test their blood
Yeah.
and see what they're low in,
Yeah, yeah, it's always good.
and then we can see whether or not somebody might need some attention there.
Yeah. Blood work is not the best at nutritional values because, you know, what's in the blood may not be what's in the tissue. But some tissues concentrate nutrients up to 8 times the amount in the blood, you know. So it's hard to tell exactly, but basically a healthy diet helps everyone. And a good multivitamin, not like a Centrum, but something from a high quality vitamin source it's just a good idea for probably most people.
Okay, here we're going to go to its attachment on the tibia and close to where the fibula is here.
Yeah, see, it comes right down below the knee there. Yeah, the Walther book was, I think it's just called Applied Kinesiology, and it's by David Walther. You could probably get that at a good price on Amazon also. Some student has it. If I wrote all sorts of good notes for you in it.
Push towards me a little and relax and push and relax and push and push and push. Good. Super. So I'm going to take a look at the medial hamstring.
Those are the semimembranosus and semitendinosus.
Yes, the semi and the membranosus and tendinosus. Now the tendinosus will attach on the pes anserinus.
Yeah, that's right down there where the 3 muscles converge to make that little pes anserinus. Is this more or less tender than the lateral?
Oh, the lateral was extremely
Lateral
tender.
is
This
more
one feels
tender.
good. You could go deeper in there.
Okay.
Gotcha,
This
gotcha.
one feels good.
Yeah, that was
Okay.
the tightest one where I
Okay.
feel the most pain. So.
Okay.
And again, it's important. The pain is important because that's the threshold of function. If you understand that, then you understand trigger point therapy. Pain becomes the limiting threshold to function. So when you start to function and you reach pain, then your body will naturally stop any function beyond that point.
Go ahead and press towards me and relax.
So if
And
we can
press towards
reduce
me.
pain, we are increasing the threshold of function. So that upper limit, the more painful chemicals we release, the more painful bands and taut bands we release, the upper limit, the higher the upper limit of function becomes.
So here, I'm taking a look at the popliteus. So I'm contracting it and stretching it. Contracting it and stretching.
Yeah, it just unlocks and locks the knee. It's just like a little can opener at the end of the joint. Just does at the end of an extension, it just causes a little twist, blink, to lock the knee. If it didn't, you could get very tired knees. People who have bad popliteus, they get no break, because when you lock your knee, you should have a break. You should be able to rest on your knee joint. But you're standing up for a long time and your knees get really tired, your legs and thighs, hamstrings get really tired. Could be your popliteus is not locking the knee for you.
Okay, so we're coming a little closer to the seat here.
Yeah.
That's nice. We're coming right along. So we're looking now. I'm going to look around for whatever it might be stopping it from coming close to your seat.
And of course, the standing toe touch is one way to measure this, but
Right.
there's lots of other things that go into that standing toe touch as well. So things with the low back.
Yes,
and whatnot, so.
many things, yeah. Gastrocnemius,
Yeah,
for one.
gastrocnemius is one. Yeah. So here we go into the
So we're coming
gastrocnemius.
along to the gastroc.
Treating it on a stretch, of
Stephanie,
course.
could you pull out the gastrocnemius? And if you could show us the popliteus, that might be nice too. Okay, popliteus. You say tomato.
Popliteus, that's what I
You
say.
say tomato, I say tomato.
Nobody says tomato. Pretentious people say tomato. And popliteus. Oh. I see. Maybe if I had some cool sunglasses like Kurt, then I'd say popliteus.
So here's the popliteus.
Popliteus, I should have known.
I say
Another one.
popliteal.
All right. I guess I'm losing this one. The way to, can I show you the way to look at the popliteus is you put your hands like this. That's how it looks. Okay, so it's attached down here to the tibia, and it wraps up a little higher on the femur like this. So your hands would be like that. So meaning that this would be since it's going like that, that would be the right femur, right leg. You see? Okay, it starts on this tibia and goes up onto the fibula and into the tibia right there. And it just helps twist the knee into a locked position and unlocking it. Okay. And the gastrocs, the impressive biker muscle, this big, lumpy, awesome-looking calves. Those are the, two bellies of the gastroc, lateral and medial, and they do cross onto the femur, so they are a double joint muscle. Okay, and the underneath, flat like a mattress underneath them, is the soleus, and that does not cross. That's just like a big flat muscle attaches all along the tibia all the way down to the calcaneus. Causes all kind of heel problems. And here you can see that the trigger points are right behind that knee, a lot of those, and they cause that referred pain. Pretty much where you'd expect them. Referred pain is about where it would be. But, except for this spot right here. You would not expect really bad plantar fasciitis pain to come from a trigger point up here, but it does.
So I just was going to review here. So for the back of the knee pain, the gastrocnemius would be the most likely, and the biceps femoris. So the gastrocnemius, then the biceps femoris,
The lateral
the
one.
popliteus, the semitendinosus,
Okay.
and
medial one.
membranosus, and then the soleus, and then the plantaris is the least likely. So coming here and all the way up,
Tiny little plantaris muscle.
and coming up over here, just like that. So
I just thought we needed one more in there.
yes, yes, we got to stand on our toes
Yeah.
like a ballerina.
A little extra kick there to help the gastrocs and soleus.
So we could go ahead and come on our ballerina toe
Yay.
and see if we can feel it. And come on our ballerina toe. There. Okay, so give that a nice massage.
Yeah. This area is going to require a lot of work. You can see how much of a jump and a twitch those nerves think they have the right to scream, yelp whenever they want. And so, you're going to have to work on them until
Push
they
towards me.
tone down.
Push. And relax.
When-
And push. Good. And now bring your heel towards your seat. And push towards me. And towards you. And towards me.
Right, hon? You got to get all those muscles, those little tiny trigger points, those tender spots. They're screaming bloody murder.
Yes, they are.
You've got to get them to say,
Push towards
okay, I will
Bring
function.
it towards you.
We go through the pain to the function that we need. because pain indicates when there's damage that we need not to move a joint or a muscle because of damage, but they tend to stay that way long after and complain far too much. Trigger points are like erroneous, message of damage that don't need to be there. So we've got to get rid of those to allow function. Did you treat the popliteus also?
I did.
Yes? Okay,
Mhm.
cool. Oh yeah, that's right. Yeah, you're doing that. Yeah. I forgot. All right.
Okay, so here we took a look and we treated all the muscles here on this side. Let's
Great.
take a look on this side.
We should probably move faster. We've only
Oh.
got a couple minutes left.
All
We
right.
may,
Oh,
we may have
sorry,
to let
sorry.
you do that one on your
Okay,
own.
we'll have to let you remember we did that already.
Yeah, yeah.
Okay,
So we
so
want to retest the muscle strength real quick. Just here.
Let's do it.
Let's just do that real quick. Let's see if we were able to improve this popliteus. So we should visibly see a difference because she couldn't even move it into position. So turn in. Okay, that's better. And I'm going to twist out. Hold. 1, 2, 3. Good. And you see I let go and it snaps. That means that muscle is good. Let's try with the foot like this. It's hamstring time. Elbow straight. Push up into my hand. And then I add 1, 2, 3. Good. It was giving a little bit, I would say, but it's a lot stronger than it was. And how about, well, this was already strong. The gastroc was already strong like this. So, good. So some improvement, definitely.
Okay, so we can have you go ahead and if you come on, if you slip off the table.
Now, we just did the adductors last time and gracilis and stuff, so we could, what do we have left? Those are the ones we have left.
Adductors, yeah.
Adductors.
Yeah, well,
and
we could do
gracilis.
the gracilis, yeah. We
Yeah.
could do gracilis. So
All right.
let's take a look at adductors and gracilis.
These are the last two muscles, folks, and then you will have completed everything that could cause knee pain.
Okay. So let's have you go ahead and lay on your side.
Oh, on my side.
Mhm.
We're doing this way. Do you want me to lay on this side?
Well, which way would you like us to do?
The same one.
Same one. Let's get one
The
good.
problem.
Okay, so
Let's get one leg good.
Yes, let's get one leg working.
Well, the worst leg.
One
We're
that doesn't
working on
work
the one
well.
that's worse.
Yeah, work on the worst leg.
okay, so this is the one that I was going to treat. So then you probably I know.
Okay.
Then you have to do the other
Oh,
way.
the
I'll
other
face it. So in this sideline position, the leg that she's treating for the medial side of the thigh here,
Just turn your
the
leg a
adductors and
little bit.
gracilis, will be the downside leg. I think that should make sense to everyone.
Yep. Okay, so we're going to take a look at the brevis, the adductor brevis. Well, we didn't do the range of motion test.
Oh, yeah, that's true. Should we have you lie on your back real quick for the range of motion test?
Yeah, we didn't do that.
Can I do it on the?
Yeah, you can do it on
Uh-huh.
those cushions,
Yeah.
yeah.
We'll do it on the cushions. Okay, so the range of motion test for this one.
Yeah.
So we're going to go ahead.
We're doing this leg?
Okay, this one. Okay, so we go ahead. So we're going to we're going to measure from the lateral knee to the table.
Or you could put the heel on the
Oh,
inside
yes,
of
we
the
could.
thigh, too.
Another way to do it is come like this,
Yeah.
and then you could measure from here to here.
So not too bad range of motion-wise.
Yeah.
Okay. Not really bad at all. Okay.
So it's about 3, 1, 2, 3.5 inches here.
Not too bad.
Mm-hmm. And the way I like to do it, from lateral. And so this would be about 6 inches.
Okay.
Okay.
Right. And,
Well, I actually would rather treat your adductors this way.
And
So
then-
stay there then.
and then also
The straight leg one.
the straight leg,
Yeah.
bring
So
it
here we're going to take it up
and let
and
it come
to the
out.
side.
And it should get to 90, so not
It's
too
not-
bad,
not
but it's
quite
not
to
quite to
90.
90.
No.
And you want to see the strength test real quick?
Oh yeah.
That was real easy. All you have to do is you brace this leg down, and then this leg push in toward the other leg, ankle toward the other leg. And then I add 1, 2, 3, 4, 5. Okay. So that strength test was okay. So the range of motion, fairly good. Strength, fairly good.
Okay, so here we're going to see the femur. Stephanie, could you pull out the picture that we're using, each thing we're doing? So it's over there. Okay, so here's our, so here, find our femur. We're gonna look at the longest and the brevis. So let's go ahead, we're gonna find the femur. We're gonna come a little bit in and press right in there.
And not nearly as painful as some of the other spots?
No.
Okay, so
I can tell
adductors.
immediately.
Adductors are in better shape than some of the other muscles we've looked at.
Because they've been worked on by you.
And I was going to say, we worked on them in the last class.
We
So,
did.
Yes, I
Yeah.
worked on them before. Not
So,
too long ago.
yeah, that's a...
Longus and brevis. Adductor, longus and brevis.
The referred pain is nothing too special with the adductors except that the magnus causes upward referral into the pelvis. Otherwise, they're pretty local. Is that them?
Yeah, put it over here. Put it right here.
Yes. Adductor longus and brevis.
So here it is. So it's actually onto the femur and then on to the pubis.
Yep.
Onto the pubic ramus there. So here we're going to come. So we just did right here by the femur first. Then we're going to come close to the pelvis there.
And actually, the referred pain is actually, you can see why it comes right down. It's a little different than I was saying. It's actually quite different. You can see the adductor longus and brevis comes right near a ball right around the knee, kind of
Well,
like
you
the
were
rectus
talking about
femoris.
the magnus.
I was talking about the magnus, yeah. And then up here, all the way up by the hip there. So, yeah. Now let's take a look at Magnus. Is Magnus right around here?
It's not too far. Right.
It's got to be. There it is. Here's the Magnus. Now you can see the Magnus. That's where the muscle is.
And then see how it goes up into the pelvis.
Yeah. And the referred pain is pretty much right where the muscle is, but then there's this referral up into the pelvic cavity, right in where the organs are. So a lot of mistaken organ problems due to those trigger points.
I'm just going to treat it a little bit while I'm moving it so I can see what it's doing. So here.
So that's shortening, and that's extending. Shortening, and lengthening, and shortening.
So I can feel the parts that aren't working. So I can feel right there, it's not working.
Yeah.
So I'm just going to hold it there and just move it just a little bit.
And again, by not working, you mean
Oh,
that
it's going into like Charlie horse or a
it's-
muscle contraction
yeah,
involuntarily.
yeah.
I mean,
it's,
just
it's
because
not
you put it-
smoothly moving through its
Yeah,
range of
yeah.
motion.
So if you put it into the shortening, passively shortened position and it
Yeah.
goes into contraction,
Right.
you know that that's one of its dysfunctions.
Yeah.
So then what's showing is that when you're trying, it's not really under your control.
Yes. It's an indication it's got a nerve circuit in there that's causing that, you know, you want to be in full control of those muscles.
Okay, next we're going to take a look at your gracilis.
Yep.
So if I can have you turn sideways and face towards Kirk.
Do we have a range of motion for gracilis? Not
Well,
really, right? It's
not
kind of like the
really.
adductor.
Yeah.
There is a strength test. You want to line your back? I'll show you the
Oh,
strength test real
good.
quick.
Okay.
All right, strength test for the gracilis is a fun one, actually. Okay, since it's in here, it brings the leg kind of down and in, so you twist the ankle so that it's turned in, and I brace this here, and I'm pushing up and out at a 20 to 30 degree angle. So you push into my hand, and I push up and out. 1, 2, 3. Pretend it's weak. It would look like this. Push, and then it would go up like that. Okay, it would go push in, and then it would 1, 2, break. But strong, like she has it, turn in and push in, and then go 1, 2, 3. Okay, so it's in at a 20 to 30 degree angle down into the table. That's gracilis.
And the test that we already did for the adductor is good for the gracilis.
Yeah, the adductor and adductors and gracilis tests are similar.
Okay.
Last muscle, folks.
So here is a tip. So it's the one that sort of sticks out right here, there, and then so that's where it attaches on the pelvis, and then down to the pes anserinus.
Yeah.
So we're going to go ahead the medial tibia.
Oh, you're very welcome. Yeah, it's a great review. There's never actually a class that Sharon has taught that I have thought all the way through, oh, I already knew this. I always find, oh, that's a great reviewer. Ooh, that's really cool. Yeah. She adds a little spice to every class to do things that, you know, you can only get that kind of knowledge from 30 years experience. So, and we've had some people enjoying the addition of the muscle testing in there. That's cool.
That's good.
There's rarely a class that has that too.
That's
I'm
fun, isn't
not
it?
bragging, but I don't think anybody quite teaches it as well as I do. Actually, I've taught it in several different states. And I even did a research project on it at Vanderbilt, exactly how to do it and what was scientifically valid about it and what wasn't. And the important thing is to get that conscious engagement. Always and always the patient has to push first. Otherwise, your results are pretty much useless.
Okay, so we're right on that gracilis here. So we're going to get right up at the attachment. And we're right on that gracilis right there.
And remember that trigger points spread. So when you get a primary trigger point, its referred pain area will activate trigger points in those referred pain areas.
So a key trigger point will refer to other areas and activate other trigger points. Sometimes that's called satellite trigger points.
Exactly. Thank you. And how about a hand for all of our devoted, what do you call these?
Viewers?
No, you guys, you come in and you're, I'm going to call them dummies. They're not dummies.
Oh,
They're
no.
Oh, I think
they're
what the
what-
people watching.
You know, all the
are,
you guys come in every week and help us with, what are they called?
Our models.
People?
Models, that's what they're called. The models coming every week. Thank you, everybody, for all the help.
And other people who aren't too far away, or even if you're far away, you could come and be in the class too.
Yeah, definitely.
And we could test you and evaluate you. You can do the range of motion tests and dance with us.
Yeah, if you've got the time and you want to come up to Chicago on a Tuesday night, absolutely.
Yeah, we'd like to have you.
Yeah. We have an awesome reality TV show coming up very soon.
Oh, yeah?
We're starting a show called Woman versus Pain. Yeah, we have a truck, a van, a really nice Euro van, like there's a Mercedes Sprinter, set up with a treatment facility inside the van, and we're going to go around the city of Chicago and other places where we're invited to show people victims, show people that model victims, to show people how to overcome their own pain, and we're going to be televising it. And making it kind of really entertaining, so it can be, who's stronger, Pain or Sharon, and we'll see if she's going to take the challenge. People who think that their pain can't be beaten, well, Sharon's going to take them to task. So that show, it's necessary because entertainment is how awareness spreads, and we need more awareness of this work.
That's right. We got to make it a lot of fun.
Yeah. Oh, we're going to do it through Periscope so everyone can watch it.
Okay, so let's take a
And we'll
look.
see if it gets picked up from
We're
there.
going to measure a couple things. So go ahead and lay on your back again. Okay. Good.
Thanks.
So we're just going to take a look at your range of motion test. Okay.
Well, we got the signs being printed, so maybe by the end of this year or maybe in the very start of next. Maybe next month if it goes really fast. Who knows?
Okay, go ahead and press your knee up towards the ceiling. And relax.
Yeah, we'll
And
email you
press
for
it up.
sure.
And relax and press it up. And relax and press it up. And relax and up
Good.
and up and up. Good.
See, it can be done.
So here's our test here.
Yeah.
As you can see, we're
Totally
doing
down.
pretty good there.
There's no measurement there. It's on the table.
Yeah, yeah. Well, we're going to measure from the lateral kneecap.
Lateral kneecap.
Okay, so there we go. And then here we went from, also did it like this. And we'll go from the lateral kneecap to about there. So that's 3.5 inches.
So,
And we were about 6 inches or so before.
Yeah.
So that was good.
so we got some improvement there too.
Then here, we went up this way.
Should,
That's nice, that's a little better.
That's a little better.
should go right up to 90, yep.
Okay, see how we do
And then
this
should
way.
come down to 90.
Not quite at 90 here. so,
But that's all right.
so let's take a look at the gracilis here. So I'd like to see if I can get people to pass the range of motion test.
Yeah, Sharon makes that a goal. She treats them in the position of testing until the function is reaches its.
Well, this one isn't probably going to do it.
Yeah, it's not going to reach it.
It did lower, though.
It did.
Lower. It
Okay,
did lower.
it did lower. Okay, push up just a hair.
I can't.
Oh, no, that's too much. Yeah, we won't do that. Okay, so next, at the end, then I'd like to do this at the end. I'd like to see if I can get the whole kneecap to be like a well-oiled machine. So I'd like to go ahead and feel it in all different positions and see if I can get it to be as flexible as possible. So I go ahead and move it around while I'm treating it. So I think we forgot to treat one muscle, Justin.
What did we forget?
Sartorius.
Well, you can watch the last class. Sartorius is
Oh,
very similar.
So push
We
first
did
knee.
that a couple weeks ago.
We did do it a couple weeks
Remember,
ago.
it's going to come from the
And push
anterior
it in.
superior iliac
Push
spine, and it's
Wait,
going to
wait,
wrap
he's
around
working
to
on
the
that. I
knee
can't
there.
concentrate
All
on
right.
both. Okay.
Push your ankle in and relax and push it in. Good. I just was thinking about that. Sorry.
Yeah. Very similar to
We
gracilis.
forgot it. Yeah. Yeah. So it's going to attach on the same spot.
Yeah.
Okay. So you're bending really good.
Okay.
So the knee's doing really well. So we could do a couple of our strength tests and see how good we're doing.
Oh, we did those already. Actually, she passed both
Yeah,
those.
I passed.
Oh, we did them all?
Yeah, she already did
All
that.
right.
I'm passing now.
Good. All right. So usually I finish it up with moving around just like I was showing.
All right.
Okay. So it looks like we did the amazing knee pain relief program,
We did. We did the whole thing.
Yes.
including Sartorius.
Yeah.
So for Sartorius, I might treat it again a little bit on the stretch. So I might actually put it in the stretch position like this.
The
They come in
Sartorius
here.
makes a lap.
And we're going to go from the superior iliac spine, come like this and treat it right like this all the way over to here.
Yeah.
Just like that.
So that's how you stretch it. How would you shorten it?
This way.
Yep. Makes
So
a
I
lap.
might-
That's
yeah.
what it makes a lap like that.
Oh, yes.
Okay.
Yeah, so then I often treat it like this too.
And so then how would you test it, you guys think? You would put it in the fibers are straight now. This is the sartorius right here. It is in a straight line right now in this position. Normally when the leg's straight, it's twisted. But here it's in a straight line. So it's treating it, boom, just like that. And so that's just how we test it too.
That's a great spot.
Yeah, the pes serene is going to be a good spot for a lot of people with knee problems.
Okay.
And here's how we would test it. We'd put it right back in that position. So make sure the fibers are straight. So here they are straight, just like that. And I'd have you hold it in this position. And I'm going to pull the whole thing down like this. Push that way into my hands. And I'm going to add 1, 2, 3, 4. Okay. And I'd say it's pretty good. Pretty good.
It wasn't too
Okay.
bad. Very good.
Yay.
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 Okay, let's roll off and let's have you stand up. Great. Super. Look at that girl go. Okay. Okay, so tell us how you're feeling.
Let's see.
She's going to do a nice test. So that's good. So now you're coming much
Lower.
close. That's only about 2 inches from the floor. So we
Little
went from
better.
about 6 to
Sure.
2. Great, great.
Great.
Want to see how you're doing with her squat test?
Flat test.
Okay, here we go.
And she thought it couldn't get better.
There we go. It's 15 there. So that's good. All right. So, how's the knees feeling?
A little better, yeah.
Good, good.
Sure.
So you were saying you had pain on the inside of the knee.
Mm-hmm.
How's that feel?
That still hurts, but the rest feels a little better.
Okay, the back is feeling a little better.
Back
How
feels
about the front?
better.
How's the front
The
feel?
quad feels a little better.
Good.
Below the knee is a little better.
Okay,
it's
great.
just still right here. But
Okay. Also, a little bit more needs to be done there. Okay.
okay.
Yeah, I think
All right.
you know what was the one there was that gracilis. So why don't you go
Gracilis.
ahead and continue to treat the gracilis on your own?
Mm-hmm.
Okay, so what do you, Kirk? Let's see what you think. Do you think that you can do the kneeling a little bit better?
I think so, yeah.
Okay, let's give it a try.
Yeah.
Okay, and you could see if you can sit back just a little better.
Yeah.
Okay, so working? Can you imagine working then?
Yeah. Yeah.
Okay,
That would be easier to do.
Okay, good. All right.
Getting there.
Good, we get a few things.
All right, great. Hey,
All right.
thank you, everybody.
So next week,
Next week,
Wear something?
we'll put this up on YouTube channel, the normal National Self-Care Alliance YouTube channel. Thank you, everybody. Thanks for sticking with us with a little longer class. We know it's a late night, so thank you for your dedication.
well, this time we got the entire knee.
Yeah. Good